The Graham-Cassidy healthcare legislation will eliminate coverage for millions of Americans.
In Louisiana, prior to the Medicaid expansion, over 1 million residents were already enrolled in the Medicaid program, and most of them are children. There are also concerns about the provisions that repeal the ACA's premium tax credits, the cost-sharing reductions, the small business tax credit, and that provide inadequate and temporary block grant funds. Block grants are something from the distant past that needs to stay in the distant past. The federal government moved away from block grants decades ago because they did not work. Because in general, in programs like healthcare and in poor states like Louisiana, where there are inadequate resources, people will be hurt. People will simply not get the health care that is needed. We already know that. With the recent natural disasters, the flooding, the hurricanes, and as we are currently still in hurricane season, people are struggling. People are struggling to recover from last year's floods. And this is the worst possible time to cut funding for health care in a state as poor as Louisiana. Right. On top of that, it's a well-known fact that Louisiana, the state, has budget problems. We have budget issues. We have a looming budget crisis. We have a fiscal cliff that has been talked about widely. The governor's been trying to get the legislature to address, and they have not come to any resolution on it thus far.
We're right there. I got your tripod and stuff.
Your chair's that LSC chair, is
Medicaid plays a vital role.
Your chair's that LSC chair. You want me to bring it up here?
Communities' resilience and ability to provide services to those who have been affected last year and this year. So this is really not the time to start taking away vital health care services and mental health services when we know we have a mental health crisis in this state. We are so inadequate and insufficient in our ability to provide behavioral health and mental health services in this state already, and the need has increased dramatically. It is not the time to be cutting those much needed services for people across the state of Louisiana. He had several occasions where he heard from the constituents of Louisiana, both publicly, privately, in meetings after meetings, and at his town halls. He certainly cannot say that he does not know where many of us stand on this issue. This will come as no surprise because he knows that this bill is harmful. It will hurt Louisiana. And as someone who is a healthcare professional myself, who takes an oath and who has to or is expected to abide by a certain code of ethics, I cannot, I'll speak for myself, I cannot support a bill that would hurt, that would do harm to people, the people who most need health care in this state. So again, I say to you, call, write, email, do whatever you have to do, and thank you for being here to show your opposition. This is actually a protest, an opposition to a policy that would roll back health care for thousands of people, millions in Louisiana and across the United States. So with that, I just want to acknowledge one of my dear friends that I work with a lot, who is also a champion for healthcare, who in fact is the vice chair of the Senate Health and Welfare Committee here, and who has been a staunch advocate for healthcare and for Medicare.
think everybody's taller than I am. So I'm Jessica with Trach Mamas of Louisiana. This is my partner, Angela. We founded Trach Mamas of Louisiana so no other mom should have to go through this journey alone. Little did we know at the time that we would be in it for the fight of our lives, for our children's lives. With this Graham-Cassidy bill, I don't know a single disability advocate who is for it. We've been told things by Senator Cassidy staffers such as, oh well, pre-existing conditions will be covered, but at what cost? Because I don't know many people with disabilities. I don't know many parents of children with disabilities that don't live paycheck to paycheck. I don't know how much financially we can do this. Yes, it's cheaper to bury our children, but we shouldn't have to. Many of us have been there, many of us have done that. But what is the ultimate cost? This is my son Gabe. He spent 382 days in the NICU. At 5 months old, we were told he would have to be institutionalized due to lack of nursing coverage provided by our private health insurance. I sobbed. That shouldn't have to happen. When is it okay that 5-month-old boys should have to go to an institution? How hard does he have to fight to walk only to be told he must lay in a bed in a nursing home? I will fight through hell and high water to make sure that doesn't happen. I cannot believe that Senator Cassidy is putting us through this, to stand out in the heat and have to fight for health care. I'm ashamed that he is our senator from Louisiana. And I don't say that lightly, because many of us, and you don't have to raise your hand, but many of us voted for him because we thought, a doctor, we're going to get a doctor who takes an oath that says to first do no harm. And regardless of what is coming out of his mouth, this bill would do great harm to so many people in his own state. It is wrong on so many levels. Like Jessica said, we are fighting, and we should only have to fight for our kids' lives medically. My son John Paul was in the NICU 5.5 months. He has a trach and a feeding tube and a shunt. And if we would lose our services, he would risk institutionalization or not survive at all. Right now we have home and community-based services. That is why he is doing so well. That's why he's thriving. With a trach, our kids, they can go into respiratory distress at any moment. They need 24/7, eyes on them and care. It's not about just moms needing some help or anything. It's not that at all. It's as vital to them being alive to have people in our home to help us. And there are many, many, many. We have 80 plus in Louisiana that are trach moms. And that's only one. We fight and we stand for everyone, all the way from kids to adults with all types of disabilities. And we have to stand together because this cannot happen. And we are saying loud and clear, Senator Cassidy, you have to stand down. You have to stand down. It is shameful that we are standing here on the Louisiana Capitol. Not only, he's not just someone in the crowd voting for this. His name is on the bill. So continue to fight with us, and your voice needs to be loud and clear. You call, you email, get on social media. If you don't know how to do Facebook Live, we'll show you how. And talk right to him. This cannot happen. Lives are at stake. People will die. This is not about fulfilling a campaign promise. This is not about, parties, which party is going to vote which way. This is a humanitarian effort to save lives. And I'm going to lead us in a chant to end our speech, because we went all the way up to Washington. We chartered a bus. It was not easy. My son had issues on the way. Gabe, as you see, is extremely active and is doing so well because he has all of his services. And even when we went up to Washington, he would not see us himself. Since July, he's got a really strong grip. Since July, we have been trying to see him, and he has avoided looking us in the eye and meeting our children. That is wrong. He knows, on some level, he knows this is wrong. So we have to cry out and let him know this is wrong. He will have people that will die, and he will be responsible. So our chant is, you could just repeat after me. Hey, hey, ho, ho, Graham-Cassidy bill has got to go. Hey, hey, ho, ho, Graham-Cassidy bill has got to go. Hey, hey, ho, ho, Graham-Cassidy bill has got to go. Hey, hey, ho, ho, Graham-Cassidy bill has got to go. Hey, hey, ho, ho, Graham-Cassidy bill has got to go. Hey, hey, ho, ho, Graham-Cassidy bill has got to go.
They're definitely the best chanters I know, and awesome advocates. And so to wrap things up today, we have Senator Barrow joined us today, and she's a great advocate for healthcare and for issues of equity across Louisiana, and we thank her so much for being here too.
Good afternoon, everybody. And I didn't come to actually speak. I came here to support you and to let you know that I stand with you. I'm fighting with you and I'm fighting for you. I have to tell you that I really love a lot of your signs. I've been taking pictures because I absolutely love them. And while they are nice and funny, this is not a nice and funny issue. What really bothers me more than anything else is the fact that we know that Dr. Cassidy is a doctor, as well as a congressman. And I've had the opportunity to serve with him, and I know who he is as a man. And someone said it earlier, I know deep down in his heart, I know he knows this is wrong. I know he knows this. But somehow, he's pushing forward with it. But what really bothers me is, when we are in this Capitol, if we would be pushing a bill down the process that was only inclusive of a few people that were in the room, it would be a travesty. We would have people everywhere saying that we cannot operate government like that. What's the rush? What's wrong with bipartisanship? What's wrong with working together? This issue is too important to go about it in this way. Certainly, I believe that the ACA, Obamacare, whatever you want to call it, I believe that it does need some tweaking. I believe that it needs some reworking. But it doesn't need to be completely repealed or replaced with something that's not viable, that ensure that all people have access to health care. That's the role of government. So I want you to know that I stand with you. I have personally contacted Congressman Cassidy and have shared with him what I've read, what I've seen, and as I interpret it, what the bill means. And he said, well, no, that's not what it does. I said, well, I disagree with you. And when the Hurricane loan closed, this is something I'll never forget because I have been on health and welfare since I was elected. I have now been serving in this body for 12 years. And so health care is one of the premier issues to my heart. And so when Hurricane loan closed, and I fought against that, but when it closed, there was a lady that I knew who died. And she died because she couldn't get the proper care. So what I do know is when we make decisions like this, or when decisions like this are made, there are consequences.
Yeah.
And people will die. They did not have to die. And so we have a responsibility. And so I will continue to stand with you and continue to fight with you and continue to be a voice and an advocate to stand up for what is right. This bill does not have to be done next week.
Right.
It can be done later. Thank you, and thank you for what you're doing. Thank you for your advocacy. Thank you for being a voice. Thank you for being out there and letting the rest of the nation know that Louisiana is not okay with this.
Thank you very much, State Senator Regina Barrow. Thank you. My name is Scott Cornelius. I am lead organizer for Indivisible Baton Rouge. And first of all, I want to say thank you so much to all of you for coming out here today. We have over 100 Louisianans from different parts of the state here tonight. So thank you very much for that. Second of all, for those of you who don't know who we are, who put this on, it was a few different Indivisible chapters from around the state: Indivisible Baton Rouge, Indivisible Senlaw, Central Louisiana, and Indivisible Acadiana as well, out of Lafayette. So if I could get the Indivisible leaders up here with me. Thank you very much. And Jackie Phelps was here earlier. I don't know where she went. Oh, there she is. She's here. Okay.
Let's all say 1, 2, 3. 1, 2, 3.
Indivisible we stand. All right, one more.
1, 2, 3. Indivisible we stand.
Now, about this bill. The last thing I want to say about this bill, for those of you who haven't been keeping up with the latest news, first of all, there was Friday when Senator McCain announced that he was once again opposed to the bill, to this bill. Thank you, Senator McCain. For those of you who may have missed it this morning, Senator Ted Cruz of Texas said the bill doesn't go far enough for him, but we'll take it. We'll take the opposition from him. But despite that, despite there now being 3 Republican senators opposing this bill, the leadership of the Senate, that's Senator Mitch McConnell, and also the sponsors of the bill, Lindsey Graham and Bill Cassidy, our senator here in Louisiana, have said they are committed to bringing this bill to a vote before the end of the month. They are committed to passing a bill that takes away our health care. So despite the fact that there are 3 Republican no's, and that, I think, did reduce the number of people who came here tonight, despite the wonderful turnout we have. You need to go back, and you need to keep calling, keep telling Senator Cassidy that we are not okay with this, and keep telling people in other states that they should not be okay with this. And that's how we are going to prevent the Republicans in the Senate from taking away our health care. So thank you all very much for coming, and you have a good day. Almost forgot one more thing. For those of you in Baton Rouge who are not signed up with Indivisible, please come see me afterwards, and we will sign you up. And also, if you're interested in doing any letters to the editor or media work like that, you can come to see me as well, and we will get you set up for that. So thank you very much for coming, everybody. Thank you all later for bringing all the stuff.